Okay, we are now recording. I'm also going to turn off the waiting room so people can come back in if you get kicked off without having to go to the waiting room or anything. So welcome everyone. My clock says 11 o'clock, so we're going to go ahead and get started. I am so excited to introduce to you Dr. Jessica Mccleese. She is a leading authority on addressing sexual concerns in therapy. She is certified as a sex therapist and one of few Christians who are certified in sex therapy. She has a practice, works full-time as a clinician and provides care for a variety of problems, but particularly with sexual concerns, and has really developed an expertise in this. She is my go-to person for asking questions about this problem. And you will find more about her at her website at drmccleese.org. So that's drmccleese.org. And you are going to be so excited to hear more from her. Dr. Mccleese is an alumni of the doctoral program in clinical psychology at Regent University and has been practicing as a licensed psychologist for over a decade now. So Dr. Mccleese, we're going to turn it over to you and ask God's blessing on you as you share with us some of your thoughts about addressing sexual difficulties and concerns in your work.
Awesome. Wonderful. Thank you so much for having me. I'm excited to be here. I should have said this a moment ago when I came in. I was hoping we'd be able to chat and interact, and now I'm not sure how to find that on my end.
No problem. The chat is open. Anyone can go on in and do that. And in fact, if you are needing continuing education for this event, if you would please sign in and type in your name for CEU into the chat. And if you go on to probably the bottom of your screen for everybody, you should see the chat. And if you click that, you can kind of move it over to the side out of the view so you can watch the chat go. So thank you very much for those of you continuing it. Any other questions for logistics that people have?
Good. We're good. Thank you. That helps me. So hello to everyone. I'm excited to see y'all here, and I can see you chatting already. So this is great. This works. I would love to know what makes you want to attend this session in particular. So that's going to help me with later trying to answer questions and make sure that I'm speaking in a way that's actually helpful for everybody. So obviously don't do any confidentiality issues here, but if you could write in some of the things that you know have been coming up for people you work with, or maybe just that you know has been an interest because of maybe it's been clients, maybe it's been friends that have talked, and you're wanting to make sure that you're offering the advice that people know people need. That would be really great. Sexless marriage, that's a big one. So for those of you that don't know, sexless marriage is defined as any marriage where you have not had sex more than 12 times. So 12 times or less during a year is considered a sexless marriage. That is a very common concern for a lot of couples. Sometimes that's because it has been a sexless marriage the entire time. So we would call that an unconsummated marriage. Sometimes it was good at first and then it's gotten worse. I see differing sexual appetites. Yep, we're going to talk about that. Trauma and sexuality, absolutely a big one as well. Increasing sexual intimacy. All of that, you're right. So these are big concerns. Women who have higher sexual desire, all of these are huge. We're going to talk about a lot of these. We're also going to talk about just in general what it looks like to work with this population, what it looks like to diagnose. So I specifically did not put diagnosing only because I know some of the people that are attending aren't necessarily licensed psychologists or licensed therapists, and so they wouldn't be working with the DSM. So I'm trying to give you a broad level of information today so that it's going to work just in general, no matter what your licensure or degree is. So I hope that sounds good to everybody. Working with couples, excuse me, all with low desire as a concern, absolutely. Sexual abuse as a child. These are huge concerns, right, that people deal with. So thank you for interacting. If you guys have questions along the way, do be sure to enter them here. I also want to leave about 10 to 15 minutes for questions. So help me with that, Dr. Ripley, so we can make sure that we get that done, because I know you guys might have more questions as I present than you had even before beginning watching this. So I want to make sure to answer those. Well, let me see if I can turn my slides now. There we go. Okay, so this is about me, just because you know what, I like to show off my husband's face every chance I get, and especially to show you how in love he is with me. So I am happily married. That's part of why I do this work, Regional Loom, as Dr. Ripley already noted. I'm also a licensed clinical psychologist and a certified Christian sex therapist. So when we're talking today, as you guys probably know, there's lots of different diversity variables that can come up for people in our office. Specifically, I'm going to be coming to you guys today talking more about that Christian audience and what that means for Christians coming into the counseling office, kind of what they're looking for and hoping for. So we're going to be taking this very Christ-focused, Christ-centered view as part of the diversity variables we're going to be mentioning today, which from my understanding really fits in well with the heart of the people that are attending today. So we're going to be talking about that a lot. Let's move on to the important stuff, the meat. So people often ask me why I even decided to be a sex therapist. Hey, that is so funny. It's literally in the chat box right now. How did you become a Christian sex therapist? So the how is actually through a program called the American Board of Christian Sex Therapy. You're going to see a link for that at the end of this resource, because I really do hope some of you are going to be interested in carrying this on and learning more about this, because there's a high need. So there's currently less than 200 practicing certified Christian sex therapists. That's in all of the world. So I would really love to see more people doing this, because there is a great need. I often tell people I have a story. So I had a lot of, you started the process recently. That's exciting. That's wonderful to hear. Can't wait. Hopefully I'll hear more from you. So I started this process early because of my own sexual abuse when I was younger. And then I saw how it was impacting my marriage. Interestingly enough, I started to become a sex therapist before I even got married and knew what a problem it was going to become. But almost immediately when I started seeing clients, and we're talking way back second year in the clinic of the Regent Psychology program, I was already seeing clients that were telling me about these sexual concerns. And I started realizing, you know what, it seems like a lot of people struggle in this area, and that it's just a common concern for people. I actually had a colleague and supervisor that would say, if you think that your clients don't struggle with some kind of sexual concern, it's only because you haven't asked and found out. So it becomes an issue for most of the people we see. So I have that there. I have a story, right? Your clients, they're all going to have stories, and you probably have your own story of what's brought you into the field of helper like this, and then also being interested in relationships and helping people improve their marriage, because that's what we're all about, right? Helping people improve their marriage. And so you're going to see these things come up frequently for couples. Interestingly enough, if you don't get certified in these programs, most of our doctoral programs, or even our master's level programs, or maybe you've gotten a bachelor's and you're going to work in the church, most of our programs don't actually emphasize the sexual piece that frequently. And so it becomes where you really do need this separate level of training and a focus to really understand what it means to have sexual concerns, and even how to ask your clients about those concerns. So I just want to define sexual dysfunction. This is based on the DSM-5. So there's a new DSM-5 TR that's out, but for what we're using right now, this is going to be the latest information about sexual dysfunction. That part didn't change in the TR version. So what you're getting, while it's not the most recent DSM, is the most recent DSM for sexual dysfunction, just so that's clear. So the definition that the DSM-5 uses is this: it's a clinically significant disturbance in a person's ability to respond sexually or to experience sexual pleasure. So they worked really hard to change the language some to make it a little bit more specific to this. This is the kind of the main category of all dysfunction. That person's having a hard time experiencing sexual pleasure in some way or responding. You might find that response and experience is different from one another. So there's actually been research to show us, especially among women, more so for women than men, that women can respond sexually, so they can actually have an orgasm and still say that was not good for me. That was an unsatisfying experience. I didn't like it. And so as we're looking at dysfunction, we are looking for both of these things, right? That there's a response and there's sexual pleasure. It's not one or the other, or we're not really getting the full experience. I've got a couple of chats here that I'm going to be looking at a little bit later as we go through some of this, but you can go ahead and keep putting those questions in. I'm going to try to get to as many as I can as we get closer to the end here. Okay, so this is the DSM-5 category of difficulties, categories of problems that people could experience in marriage. You're going to notice that some are more specific to males and some are more specific to females, and that's kind of how this works when the DSM categorizes them. So for men, obviously, the delayed ejaculation and the erectile disorder. For females, orgasmic disorder, sexual interest or arousal disorder. That was one where they changed the name from the DSM-4-TR. Genitopelvic pain or penetration disorder, male hypoactive sexual desire disorder, and premature or early ejaculation. You're probably noticing, hey, we just put several things in the chat that the DSM doesn't seem to talk about. That's true. That's why I'm actually going to show you some of the ones that require that DSM diagnosis. And then we're going to talk a little bit more about some of the ones you put in the chat where maybe they're not specific to a DSM diagnosis, but they are specific to impacting a couple's relationship and really causing some of those concerns. So we're going to talk about those. And I would expect that you're actually going to see more of those that we'll talk about near the end of the presentation than these. Does anyone have a guess why you may see more of those other issues more frequently than these, the DSM notes? So you can throw those in the chat if you have a question about that. Y'all already have a lot of good questions coming in, so this is pretty exciting. Okay, so let's look for just a moment at the criteria for sexual dysfunction. So I already gave you guys the actual definition, but beyond the definition, these things have to be going on. You see on the screen, a couple of them are bolded. Those are called your morbidity factors. And so we're going to talk about that during the presentation as well, but that's why they're bolded. And then just keep in mind that these things all have to be ruled out, or these other things have to be ruled out. So what you see at the bottom there, the other things to consider, those rollouts have to go into your diagnostic criteria as you're looking at seeing if one of these things are going on. So number one, for someone to have a sexual dysfunction, it has to cause significant distress. So if you have a couple come in, for instance, someone mentioned this earlier, and having the difference of desire levels, which is really common for couples that we work with, what's happened historically is people tend to categorize one or the other as having the dysfunction or the issue. And so let's just assume, for the context of our conversation, that someone's thinking that lower desire person is the one who has some kind of disorder because they don't want to have sex that frequently. But if they're not worried about it and it doesn't cause them distress, then keep that in mind, that that's actually not diagnostically something that you can give them. So you can't give them this low desire disorder if they're like, I don't feel bad about this. This is who I am and I'm happy with it. So keep that in mind. So it has to cause significant distress. You also have to rule out those other possible causes. All of those listed at the bottom. So anytime we're looking at a possible sexuality disorder, we need to see, are there partner problems? So if you have a couple that argue almost every time they get together, it would not be surprising that they have a sexless marriage. And so all of a sudden, the sexless part of it isn't actually the issue. The problem is they need to work on their relationship first. I'm sure there's been many times when you've worked with couples where they think they're coming in for one issue, and you realize as you work with them, there might be other things going on here that are actually relevant. So that's what we got to do when we're looking at diagnosing. You look at the relationship, you look at any kind of mental health concerns, the cultural or religious aspects. We'll talk about some more of those in a little bit. And then any medical concerns that could be going on as well. You got to make sure that the symptoms have gone on for at least 6 months. So any of those symptoms or any of those diagnostic categories that we just looked at, if their symptoms haven't been present for 6 months in all or almost all of their sexual experiences, then it's actually not something that you can give that diagnostic criteria to. So be aware of that. This could be difficult to diagnose. So first of all, you can actually only use the DSM to diagnose if you have a license to do so. So there is training for that, obviously, in your educational programs to be able to diagnose. Some of the criteria is still a little bit subjective, right? So if we look at those things like it needs to occur all the time or 75% of the time, well, unless someone's actually taking notes and writing down when these symptoms occur, it's going to be based on how often or how frequently they may think that this is going on. So keep that in mind as well. And then not everyone who meets those criteria will ever come to your office. So I asked a moment ago, why do you think that it might be that those DSM categories we don't see as frequently as the others? And I see even someone had answered that their recent medications. Absolutely. So a lot of people will take those concerns and they'll see a medical doctor before they see a therapist. Or believe it or not, a lot of people are actually okay with just having these concerns and kind of sitting in that place of this is my life, this is what it's going to look like, but they'll think to themselves, there's no way I'm going to share this with somebody and talk to them about it. So people can have a really hard time revealing what's going on. How many of you have ever been in a session where one person might mention, hey, we have some sexual problems, and the other's like, hey, we're not talking about this. Or one person will say, that's why we're here. And then boom, they start giving all the information. So this can be just really difficult for couples to talk about or for individuals to talk about. So that's going to play a role in how frequently you see this. So the primary steps for diagnosing, if I didn't add this to the notes, but Caitlin, if you want to remind me, I'll add sexual history form as well when I send you guys the slides so that you'll be able to share that with people. But the primary step for diagnosing a sexual dysfunction would be a sexual history. I want to also let you know that this is also a primary way of just getting the information that you need to understand what's going on with a couple. So even, or an individual, sometimes individuals are coming, not necessarily with their spouse. So the sexual history form is something that's important for every couple, every individual you see where there's any hint that this might be going on. If you want to know if there's a sexual concern, you can actually start with the question of, how's your sex life? That's it. And the couple will tell you what's going on and if there are any problems there that they want to talk about more. And then the sexual history becomes really relevant. I'm going to send one to y'all. Like I said, one thing I do just want to note, when you're doing a sexual history, this is typically something that you would do individually, not with the couple together. So you would talk to each one of them, ask them for this information, get to know their struggle more readily, and then offer feedback as a couple so that you can protect each person's individual privacy, because there may be things that they want to tell you about so that you guys can do some work together, but maybe they haven't had that conversation with their spouse, or they're not open to having it now. So we got to assess for the non-sexual concerns. Already said that. So think of things like depression or anxiety that might be playing a role in keeping them from being able to connect. If someone is severely depressed, they're not typically thinking of having sex very frequently. So what one partner may say is a low sexual desire disorder could actually be depression that needs to be worked on. And while working on that, you might find that the relationship starts to heal in that way. So be aware of that. And then ruling out medical concerns. So think of things like diabetes. So people who have unmanaged diabetes, men can actually find that they have erection difficulties because of that, or they can sometimes have those difficulties because of the medication that they're taking for something like diabetes. So we really want to be aware of any kind of medical concerns that are going on. We never tell people, hey, these things can get better if you just get off that medication. We send them back to their primary care physician, right? And say, please let your physician know that you're having some sexual side effects and see what they can do for you. See if there's some other options out there. Same thing with medication. We never tell people, hey, go take this medication. I've heard it helps with delayed ejaculation. Instead, we send them as a referral, right? Go see your medical provider, let them know you're having this concern, and let's see if we can work together and they can do what they need to from the medication side, and then we'll do what we need to from the talk therapy side of things. Okay. So here are some common referrals that I want you guys to be aware of, because these, if you're seeing sexual concerns within your clients, you're probably going to use a lot of these common referrals. So a urologist, that's really great for any men that are having ejaculation issues or erectile issues. So a urologist can actually even do what would be basically like an not x-ray, like a sonogram on the penis to see, are the blood vessels working correctly? Is this something that's, is there a reason that this is being not working for you? And that way they can provide any kind of medication that's needed. Primary care physician, of course, just to get a basic health checkup and make sure that everybody's body is operating the way it should. Endocrinologist is great for any kind of possible hormone issue. And then pelvic floor therapist is the top recommendation for any women who are experiencing sexual pain. And actually, believe it or not, for men with sexual pain as well. So typically we think sexual pain and we quickly go to women because it's far more likely to show up for women, but it can show up for men as well. And so being able to look at a pelvic floor therapist, that's extremely helpful. And I'll send you guys the link for that too. I think I did not include it in here, but I'll make sure you have the link for pelvic floor therapy as well, so that you can send people to others that are certified in this direction and able to help them. Certified sex therapist is really helpful. I am saying here, consider a Christian sex therapist, because most everybody watching this, I would say, is probably Christian, and then probably a lot of the people you see. I see probably about 90 to 95% Christians coming into my office, and then I see people outside of that as well, but typically it's Christians seeking me out. So consider a Christian sex therapist, because someone who's not a Christian might be recommending treatment options that don't feel good to a Christian. So they might go against their faith. Things like pornography use. Believe it or not, I've actually had people come see me after seeing other sex therapists that weren't Christians, and they'll tell me, they told us we should probably start doing some swinging. They've told us we should maybe do some wife swapping. They've told us we should learn with other couples. So keep that in mind. It's really important as you're making referrals that you know who you're referring to, because especially if you're sending someone outside of your office and you're not going to see them again for several months while they do this other work, make sure that you understand what they're going to be learning and make sure it's a good fit for your clients. That's good care, right? And then finally, a trauma-informed therapist, or EMDR certified therapist. I told you we're going to talk a little bit about things that aren't related to the actual diagnostic categories, and that's true. I'm not going to hit on trauma a lot because I'm actually not certified in trauma. And when I have couples where trauma is a significant issue for them, I actually send the person who's had that sexual trauma to either someone who's trauma informed at least, but I prefer EMDR if I can find someone available for them, because that's really going to be a primary treatment for them before we even start working on sexual intimacy. So make sure if trauma is rearing its head for your couple or for your individual, that you're looking into someone certified in that area before you're looking at sex therapy. Just to clarify, sex therapy is going to be more for working on the couple's sexual intimacy and improving that. It's not going to hit a lot on overcoming sexual trauma. That's a different certification. And it's also not going to hit on the sexual addiction piece. I've already seen some questions coming in about that. The sexual addiction piece is a very specific certification as well. So I have someone I refer to when sexual addiction is coming up, because again, sex therapy is just not the same as sex addiction therapy. And it's important that whenever someone's coming in, they're getting the actual person that they need that is certified in the work that they need to do. Hopefully all of that makes sense. Okay, here's some of the ones you guys were thinking about more, right, that are coming up for you, the ones that feel probably very relevant to your people that you're seeing, because they do come up frequently. So I'm going to name these three, and then we're going to go a little bit deeper and talk about each one, and then we'll hit on your questions. So the desire differences would be a big one. This is a term that I like to use that literally just means one person in the couple has a higher sexual desire than the other. This has nothing to do with who has the higher desire. This isn't even looking yet as looking at, are one of those desires maybe outside of the norm. It's literally just saying this is an issue that you might deal with, those sexual desire differences. Lack of education is another one. Typo, nuts. So lack of education is another one. This can be in regards to how the body works or the sexual response cycle. So sometimes you'll have couples or individuals coming in, and maybe their parents, when they were growing up, never gave them a lick of information about sex. If they were homeschooled, it may be even more so. They don't know anything, and now they're supposed to get married and have sex, and they have no idea what this is supposed to look like. So lack of education can be a really big one, especially amongst Christian couples, unfortunately. And then shame can be another one of those. I'm pretty sure I saw that in the chat as well before I was even getting very much information going here. Shame is another one that a lot of Christians will deal with, and one that we're going to come up against over and over again in our work with a Christian audience. So let's go a little bit deeper into each of these. So the desire differences, just give me a yes in the chat if you have heard that there's a difference between what would be spontaneous desire versus receptive desire. So if you've ever heard that maybe there's some difference between how men and women, lots of people, wonderful. So you guys are not unfamiliar with this, but your clients may be. So this is actually, what I'm finding is this is appearing more and more online, and people are starting to hear like, oh, there actually might be a little bit of a difference here between the way men and women respond to sexual advances or how interested they are in sex. So I would make sure that you do know about this if you haven't learned it before. So the spontaneous desire, typically attributed to men. I saw a question in the chat earlier, what if the wife's drive is higher? So spontaneous desire is typically attributed to men, but it is not always men that experience this in a couple relationship. So typically the one who has the higher drive or higher desire, as your couple might say, what they really have is that spontaneous drive or that spontaneous desire. This means that they're interested in intimacy, they're interested in sex, and it just kind of is there for them pretty frequently or pretty easily. They don't need as much lead up as the other spouse to get them interested in intimacy. On the other hand, receptive desire is typically attributed to the female, but it is not always the female, but typically attributed to the female. And that means that that person isn't necessarily thinking about sex, but then when they're invited into that relationship, they think, hey, I think I would like that. Or with maybe a little bit of foreplay, then they think, yeah, actually this would be fun. I want to engage in this way. So helping couples understand this difference, they may learn that they actually don't have as large of a desire gap between them as they think they do. So a question I like to ask couples frequently when they're in this place of believing we want sex, to different degrees, I will ask them, take a little piece of paper out, don't share it with one another, but write down, how often would you want to have sex if you had the time and the energy? And a lot of times couples actually have about the same number. Sometimes it can be different. And of course, there's work to do in that area if that's the case. But for a lot of couples, they'll actually have a similar level of desire. They just seek out that encounter with one another a little bit differently. So that's something to be aware of. Understanding the sexual response cycle, that's part of that spontaneous receptive desire. But Reed's erotic pathway model is really great as well. I knew I wouldn't have time to go over it today, so I'm letting you know it exists, so you can Google it and look it up. But he talks a little bit more about the seduction phase. So instead of just going directly to foreplay like our models typically talk about, he talks more about kind of setting the stage. I actually like to tell people it's like staging your home when you're ready to sell it. Staging your home does not guarantee a sell, but it makes it more likely to happen. And so if you can learn to kind of stage your environment for a sexual encounter, it makes it more likely to happen. And that can be everything from the way you talk to one another to maybe setting up the room. Maybe you're going to put candles on and turn out the lights and make it a little more appealing to one another. That's part of that seduction stage. Reed's model goes into this more deeply, and you guys can look that up, but it's going to help couples figure out how to set the stage and make a sexual encounter more likely between the two of them. All right, lack of education. I always hesitate to know how much I'm allowed to share when we're in a forum like this, but I have so many stories of couples where there's such a lack of education that it can be somewhat surprising the things that people don't know about sexuality. So people can not know how their bodies work. People can find that they were never taught things as simple as how an erection actually develops, or even how in the middle of sex the man is able to enter the woman. And so there can be a serious lack of education for couples where you have to be able to describe these things to them for them to be able to have an intimate relationship. So it might mean actually having conversations that right now, if you think about them, may feel a little bit uncomfortable. But it's important for you to be able to learn how to have a conversation with your couple, because the comfort level that you come into the office with, that's going to set the stage for how comfortable they feel. So I've literally had to talk to clients about what it looks like to engage in intimacy from one another from these very practical standpoints of even how the man can position his body with the wife so that they're both comfortable and able to achieve penetration. So again, I'm trying not to get too graphic on here because I know it's going to be like on YouTube and that gets, but you guys have to be really comfortable with talking about all of the things that your couple may be a little bit embarrassed to even say. I like to get couples where they're even willing to just say the words that maybe they haven't said before. So I have verbal communication exercises that I walk my couples through. So I've had couples sit in front of me where they're like, like there's this issue kind of like down there. And I'm like, down where? What do you mean? And so I really try to encourage people to actually use the words, because that's how they're going to communicate with each other more fully. But it's also how I'm going to know what's going on to be able to talk to them about any concerns they might have. So you got to get comfortable explaining all aspects of sex. So everything from how pregnancy occurs, how the sperm travels out the penis, how it travels into the fallopian or into the uterus and fallopian tubes. All of this you got to know to be able to sit with your clients. And then also all the tips for relieving pain, different positions that might be helpful for them. Things like using lubricant. All of these are really important factors that your clients may not actually know about. So keep in mind that there may be things that they don't know about that you think is common knowledge, but it may not be for someone who grew up in a home where they weren't allowed to talk about sex. Okay, moving right along. Shame and trauma. I already said this earlier. For trauma, just make sure you're referring to a specialist that actually works in that area. That's going to be really important. Then for shame, I would encourage you guys to get really educated in what it looks like to overcome messages of shame. There's some really interesting work being done in interpersonal neurobiology, where we're learning actually kind of where in the brain shame seems to be triggered, and we're learning how to overcome a lot of that. There's actually been some really great research on how joy overcomes shame. So that's coming up in a lot of research. And joy, interestingly enough, is not a feeling of happiness, but joy is knowing in the midst of suffering and hardship that things will eventually get better. So I would almost even call it a hopefulness, but joy is the term that's being used right now in helping people overcome shame by knowing that things can get better. This is part of the education can really help couples overcome shame too, because you can teach them, regardless of how you grew up and maybe what messages you received, we really can get to a place where we're allowed to talk about these things. And it's not anti-God, it's not anti-gospel to talk about these things. I actually tell Christian couples quite frequently, God created your bodies. If we really truly believe that God is good and we believe that his creation is good, that's one argument to say that sex is good. And if it's not good for you right now, we can work toward making that a good and a pleasant experience, because we do believe that God is a giver of good gifts. So certainly this is one of the gifts that he gives us that we can improve upon and really enjoy. Now, I'm going to quickly go through some of these resources that I have for you, and then I want to jump into the questions to make sure I'm giving you really relevant help today. So you'll see here, drmccleese.org. That's me. So that's my website. Tons of free resources on there. I got a couple of free guides to help couples improve their marriage and improve their intimacy. So that's a good start for you. If you're doing any kind of sex therapy, specifically for the dysfunctions we talked about earlier, but also shame, the Pinners talk about this. So Pinner and Pinner are in their mid 80s now, I believe. They've been doing sex therapy for somewhere around 50 years. And they have a book, Counseling for Sexual Disorders, that's going to help you walk couples through things like erectile dysfunction, desire differences, shame, and even body image issues they talk about. So that's a great one. Rosenau's book, A Celebration of Sex, is a great manual as well. This is good just for in general, helping couples really come together, but it's also going to help you with all the dysfunction language and how to work through that. Soul of Shame is by far my favorite book right now for helping couples overcome shame. So that one's going to use a lot of that interpersonal neurobiology. It uses a lot of Dan Siegel's work to talk to you about how the brain feels shame and what we can do to overcome that. Sexual Wholeness, if anyone wants to become a sex therapist, I encourage you, my friends, to do that. And you can learn more at their website right there. The one there, the ISSWSH, if you are interested in working with ladies who are experiencing sexual pain, this is the go-to resource. They have updated information all the time, and they're going to be giving you medical information, physical information, how to help women that are struggling, top of the line info if you're interested in pain. And then Dr. Camden, also a Regent graduate, and she talks a lot about shame on her website, and especially for Christians. I would say even more so for Christians that are probably millennial age, maybe a little bit younger than that. So ones that have come through kind of the purity movement that some people have struggled with. She has a lot of resources on how to overcome the messages that you heard during those times if you were in that experience. So awesome. All right. I know I rushed through and talked really quickly because I wanted to make sure we had time for questions. I'm trying to scroll up here to look at some of these, and do feel free to send a few more if you want. Let me see where they started.
Would you like a little help, Dr. McCleese, with that?
Awesome.
This is
Yeah.
Jen McCleese. Yeah.
That'd be great.
I know there's one we haven't covered yet. I wondered if you wanted to cover around people when they were young and have trauma and they kind of over sexualize at an early age. And if you have any thoughts about that, that's one we haven't been able to touch on yet.
Yeah, and I'm assuming this is kind of specifically for Christian couples or Christian people, maybe.
Yeah, I think we can assume kind of a Christian sexual ethic in general in this community. Yeah.
Yeah, so you're right. That's a hard one because when someone has experienced trauma, it's kind of like there's this great divide that I've seen in clients where either they're totally anti-sex at that point because of the trauma, or they might find, like you were just describing it, like everything is sexualized. Maybe they have a lot of sexual jokes all of a sudden. Everything they hear, they think sexually about. I think it's really good to remind people, especially from a Christian ethic, that there's a way to view sex that a lot of people struggle with, and it's you can't go to either extreme, right? So you can't say sex is awful, sex is bad, nobody should do it, but we must to keep our population alive. Like that's not a good, healthy way to look at it. But it's not also not on the other side. So I literally listened to a video of a pastor the other day on YouTube talking about anything you want to do in marriage is fine as long as you both agree. And I was like, no, because I know what people want to do in their marriages sometimes. And it leaves one person maybe severely shamed, or it leaves one person feeling bad about themselves, or causes medical concern. So that's actually not a good ethic. So what I like to tell people when we're looking at over-sexualized beliefs that you're seeing in couples, there's a couple of things we want to look at. First of all, keep in mind that it could be kind of this sexual addictive mindset, and you might actually need to send eventually for a referral for someone who does sex addiction work. Dr. Carnes is a great resource in that, and also Dr. Laser, which is Laaser. He's a great resource. So you can start by looking at some of their material for helping couples out, but ultimately that might be a referral to a sex addiction therapist. Outside of that, though, I've heard couples, or I've heard Christians use the language of an idol. And I think that can actually really help. So teaching couples how we actually, or individuals, we can actually make sex an idol. Well, that then becomes the thing that we're looking desperately for. So there's this law of worship, right? By beholding, I become. That's scriptural, right? So if I am seeing something as the most important in my life, I am going to lean toward that direction over and over again. So we have a goal to constantly pull people into this place of balance. Our ultimate goal, our ultimate salvation is always going to be Jesus. And if you're at a place where you think sex is your ultimate salvation, you will be left wanting because it's never going to be enough. And so if everything becomes sexualized, I can guarantee you, you will never have good enough sex where you think, and now I've met the goal, because you're always going to want more than that. So what we're trying to do is remind people, like, in this world, you're going to have suffering. In this world, you're not going to have every single need met. In this world, there will be times when you wish you had better than you have. But it's in those moments that God sits with us. It's in those moments that we can find our comfort in him. So if that's the case, if we can find our comfort in the Lord, that becomes part of our actual sexual ethic. We do have physical wants and needs, right? And that's okay. It is absolutely okay to have those wants and needs. But we also live in a fallen world. And sometimes our wants and needs, first of all, don't actually line up with Christ. And other times, they just simply won't be met, even if it's a good want, even if it's a true need. And so in those moments, we have to start deciding what's actually more important to me. Typically for someone who's over-sexualized, what's happening is they're not able to do relationship well with others. So if they're married, it might be they can't do relationship well with their spouse anymore. And if they're unmarried, they may find they just can't find someone who feels the way they do. And so if our ultimate goal, John 17, right, to live in unity with one another and to love one another and to show the love of Christ, if that's truly our ultimate goal, sex can't be way up here, right? I'm trying to not go by my screen. Sex can't be way up here. It has to somehow, be here. And then Christ is up here. So part of it is learning the proper balance of what it means to walk in your Christianity. Does that seem helpful?
Yeah, I think that's very helpful. Thank you. We have another kind of unique question from Dr. Topeven. I'm curious about what your thoughts are on the role of artificial intelligence. AI companions is coming out. There's discussion, I know, among sex therapists about that, and issues of healing, intimacy related issues. What's your view on that?
So I don't know if this is what you meant. I automatically thought sex robots because that's been something that's been talked about for a very long time. I don't know if it's really coming out. I haven't kept up on the research about that. I know back when I started my certification program, which I believe was 2009, everybody was like, this is coming, this is coming. So it doesn't mean it's not coming, but I don't know how quickly it'll be in front of us. Even so, it's the same goal we've always had, right? So Christianity, first of all, Christianity has always been a little bit countercultural, right? So we're always called to a higher standard than the rest of the world. And so I don't see potential benefit to having a robotic experience being what you have for sex. I just cannot fathom a potential benefit for that where you would in that process learn how to relate well to others.
Can I clarify one point? Is it okay if I say something?
Sure.
I didn't mean to talk about sex robots, even though they are definitely coming. Talking about mostly AI companions in the apps that are being promoted right now. They are out. They're not coming. They're out.
Okay.
And their background programming language is quite advanced. And they literally can mimic intimacy and asking intimate questions, everything from how was your day today, things that people wish for that we may think about what you talked about staging earlier. And there are some anecdotal reports already out of people using them as a sort of psychoeducational tool. This is how you could learn to talk in order to create better intimacy. And I'm wondering if you see that as beneficial, because that's happening already.
So I would have to probably research the app a little bit. Honestly, I don't know about that. My primary thought on it would be really, the aim that I'm always going to have for others, especially for Christians, because of the Christian ethic, is that we learn relationship with one another. So it's a little concerning that people might replace actual relationship with one another with a computer. I think we've already seen some negative effects of that with things like social media, where people feel connected that way instead of an actual relationship with one another. So I'd be a little concerned about that. If it's like literally a list of questions where then they take those questions and ask their spouse and then they discuss it together, that could be different, certainly. But I don't know the apps. I'm afraid I can't answer completely with that. What I do know is my goal is always going to be for couples to be having those conversations with one another, not with an outside source, whether that outside source is an app or pornography, because that's actually been an argument people use for porn as well, right? Well, we can watch this and then we can learn, then we can try it. And I don't think that's helpful for couples either, because it teaches them to have arousal to other beings instead of to their spouse. So I think potentially it could be problematic, but I haven't seen the apps. So that's answering without really fully understanding what's present in those.
Okay. We have another question from Laura Mary Gold asking about many of the clients that she sees are older and have been hearing, I'm no longer attracted to my spouse, aging, changing body. I've heard, we have another question in there similar about kind of low desire for older aging people. If you have any thoughts about responding to that as a therapist.
Yeah, so first of all, we didn't talk a whole lot about low desire and what it actually looks like to diagnose that. So I would encourage, first of all, we want to know what they even mean by low desire. So do they mean they want to have sex twice a month instead of the every 3 days that they used to? So is that the case? Is it more about kind of hormonal response where they just don't get aroused that often, or it's not that important to them? Do they not find their spouse attractive? And if so, how long has that been the case? Like, is that a problem of aging, or have they been feeling that since they were both in their 30s? So it's really important that we get enough information to actually know where the source of that problem is. I do believe that couples can increase their desire for one another, their physical desire for one another, as they concentrate on some of the other things, like increasing that emotional connection. If they've gotten away from actually trying to have sex, then you want to bring some of that back in. Get them to the place where they're working on some sensual massage and things like that, and see if this is stirring up desire for either one of them. But I would want to know a lot more answers to some of those things. The other thing you can do, so I told you about celebration of sex from Dr. Rosenau. He also has one, celebration of sex, I think it's after 55 or after 60, something like that, that's more specifically designed to the older couple who are struggling with things like medical issues that are standing in the way for them, changing bodies. So that would be a really great resource that'll give you some exercises and give you some words to use with your couples.
Thank you. That's really helpful. There was some discussion earlier. Megan Christensen was asking, and Dr. Bruns was joining in about sex addiction not being part of the DSM. It's not a DSM diagnostic category. And what some of your thoughts are about sex addiction and how you kind of classify that in your work with clients.
Yeah, so you're right. That's not a DSM-5 category, but it does affect couples. So I've seen kind of like sexual shame is in a DSM category, but it can affect couples. Desire differences is not a category, but it can affect couples. So I have seen people where the addiction piece is a huge problem for them. Like I said earlier, I refer those couples on because that is a whole separate certification. There's actually a sex addiction certification that I don't have, and so I don't try to see those couples or those clients, those individuals, because I know that I can't be as effective as a colleague of mine. Well, that's all he does. So I do refer those clients on. That being said, yes, I do believe that addiction exists. I do believe that couples struggle with it or individuals struggle with it. I don't have the certificate or the training to distinguish between over-sexualizing and addiction, and at what point we can say it becomes an addiction. But what I do know from couples I've worked with, because I've often worked with the spouse of the addict, while my colleague rather works with the person who's dealing with the addiction. And one of the things that I see coming up frequently for them is the person who is in that state of addiction. We see similar symptoms that we would see in any other addiction. So they're getting in trouble. People do, their wife or their husband sometimes is the case, does not like that behavior. They don't want it anymore, and yet they continue to act out, or they try to put things in place to stop themselves and they continue to act out. So that does make it seem pretty addictive in nature. A lot of times we see things kind of increase, almost like you would with a tolerance with something like alcohol, where people kind of need more or want more or have bigger experiences in mind. So there are definitely symptoms that make it qualify as an addiction, which is why people use that language. But it's not in the DSM anymore. So there are probably several things that we see today that may not be in the DSM someday, because it's rapidly evolving and it's based on partly on the culture, right? So the DSM isn't like the Bible that's, inspired and truthful. It's going to be based on how are people behaving, how are people experiencing their life, what do people want out of life, and that's part of how we start looking at how are you outside of the norm, right? So we take, this is what most people experience, and if it's outside of the norm, that's when it becomes DSM related. And with sex addiction, that's just a really hard one, because people have tried to figure out, well, is this actually a problem, or do they maybe just have a higher sexual drive and higher sexual needs than others? So DSM is not a Christian sexual ethic, right? It's literally just a picture of this is outside of what we could expect in the norm for our culture. Does that help? Does that answer what you're asking for?
I thought that sounded really good. Yeah, very helpful. Yeah, we maybe have time for one or two more questions here. Joyce and Jared Tan were asking about doing like kind of regular couple therapy, couples in counseling, and the couple wants to increase sexual intimacy. So this may be something pretty common for people doing couple therapy. Do you have any suggestions of things that can be helpful for that?
Yeah, so Sensate Focus is a really popular way to increase intimacy. That's going to be in the Penner's book, Counseling for Sexual Disorders. So what it teaches is how to have sensual touch with one another to increase kind of how the body responds and increase that desire for sexuality. Little things like getting hormone checks can be helpful as well. But a big part is the relationship. So there's a book, I can't think of the title right now, Come As You Are, by Emily Nagowski. That is not a Christian resource, but she has some really good research on sexuality, and she talks about the difference between an emotional intimacy, an emotional desire, an emotional arousal, you might even call it, and then physical. And so she talks about how both need to be present, and sometimes we focus too hard on one. So if we're focused only on the physical arousal and not even looking at the emotional, then we have a hard time getting couples to feel more connected and intimately desire one another. And so we need both. And for a long time, it was taught that women had more of this dual need of emotional and physical, and men didn't have that as much, but that's simply not true. Dr. Barry Robinson, he talks about it as well, and how men actually, in his practice of over 40 years, and he's not a Christian either, he's learned that more and more men actually have that deep need for that emotional connection. And so he says we've really done people wrong by not teaching about this and trying to work on both. So when you're working on helping couples increase their physical desire for one another, we have to remember that we're complex beings. We're not just a physical body, but we're an emotional self, a soul as well, you might call it. And so most couples are going to need that emotional connection as well. In fact, I was working with a couple not too long ago where the wife felt like, well, we are having sex now, so I think things are improving. And he was saying, I don't feel like they are. We're still not emotionally connected. And that's a common comment that I get from couples. So most couples will say they actually want both. So keep that in mind as you're working with people. You're always staging the experience, right? So you're helping them connect. I like to talk about that kind of triune being, if they're Christians especially, helping them connect on a spiritual level, feeling like they're on the same same page there, helping them connect emotionally and on that friendship level, like Gottman would talk about, and then helping them connect physically. And we can't leave any of those behind for a couple to really actually begin growing in that intimacy and that desire with one another.
Oh, that's really great stuff. Thanks. Good stuff there. I think we have time for one more question. So I'm going to go ahead and throw at you a tough one from Amber Thornton. Advice on helping couples who've experienced an affair and they're restoring their marriage emotionally and physically. Do you have any specific advice for the post-affair relationship?
Yeah, man, affair work is so hard. I like to use Dave Carter's work. So he has a book and a workbook called Torn Asunder. That one's a really good resource that I like to use with couples. Expect this to be long, difficult work. Like you're probably going to be in sessions, for a year or more, helping that couple achieve a closer intimacy with one another. But as far as the actual resources, he just has a beautiful layout for helping couples learn to talk with one another, all the way from like their early childhood experiences to now in the present. What do we need in our marriage? So that's a fantastic resource. I would also encourage you, so couples can take kind of one of two approaches. Some couples think if we just start having sex again, we're going to secure our marriage, we're going to feel good, this is going to be great for us. And other couples, or one partner in either of these situations might think like, I can't, sex is a no-no right now, I just can't bring myself to do that. And neither one of those are always the right answer. So it's always going to be about the couple you have in front of you, learning from them, what does sex mean for you? How do you see it playing a role in your marriage? How has it played a role in the past? Like some of this is that kind of sex therapy assessment we talked about before, right? Getting a clear understanding of what is the value that you place on sex? What do you need right now to feel safe in the relationship? And again, trying to help them find that balance between what does it look like to have a healthy sexual relationship in light of these difficulties. So for some couples, you may actually tell them, hey, let's hold off on trying to work on the sex part of this right now. Other couples, you may find that is really truly what they want, and they feel more connected and they feel closer and they feel much more likely, or much more ready rather, to work on the emotional part of their relationship. So there's probably a lot of arguments on either side of those, but again, it's the famous favorite answer of every therapist, right? It depends. So you sit with your couple and try to help them understand, is this actually the way forward for you? So let's say you guys all talk about it and your couple says, yeah, we think intimacy will help. And then they go have sex and the next week they see you and they say, man, that was a mistake. Everything just blew up in front of us. And this is how we started treating one another. Well, then we know, right? Hey, let's just take a little pause and let's work on the emotional relationship first. And then the same would be true in the opposite. If a couple said, we think, maybe we're going to wait, and maybe they wait for 30, 60 days and start saying, man, every time we're together, we fight now. We both think we actually need the connection, but we're not sure if we're allowed. Well, then you can give them the freedom. Like, hey, it is okay. You are allowed. Have sex if you want to. So we're always walking alongside our client and making those pivots as they do to try to provide an experience for them where they can learn and grow together without putting all these rules on themselves of what it has to be. So their relationship is dynamic, and we're helping them learn how to live within that place of ever-changing days that they're going to experience in affair recovery. And then remind them the emotions are normal. So the highs, the lows, the feeling, people describe it as feeling bipolar. So letting them know that, hey, that's an expected experience. This happens, and teaching couples how to ride those waves and how to talk through triggers. All of that becomes exceptionally important when you're working with an affair recovery couple.
Thank you. These are all extremely helpful and very unique things for us all to be learning about addressing sex and sexual issues in working with couples and families. So thank you, Dr. McCleese. We are so thankful for you and for your presentation to us. We will be sending out to everyone who participated the link to this video, as well as the resources that Dr. McCleese spoke about. And we have another presentation from Dr. Mark Yardhouse talking about same-sex relationships in November and addressing that from a Christian perspective. So you'll want to look for our email on that, as that will also be on a Tuesday at 11 o'clock. Caitlin, do we have a date on that handy?
Yes, so I believe it's November, I'm just looking at the calendar real quick. It's November 8th. It'll be Tuesday, November 8th at 11.
All right, so just letting you know about that. Thank you again, Dr. McCleese. I hope you can see all the thank yous going on in the chat there.
Yeah.
Some really great information here. People, I think, really appreciating this presentation and your time
Awesome.
with us. Thank you, everybody. I hope you have a great day today. Lord be with you.
Bye, y'all.
Bye-bye.